just my name and then, okay. Carla Frank.
Okay. He's real Hollywood here.
It takes a long time and a lot of money to get a medical device out into the market. A non-implantable device may cost you about $10 to $20 million and 3 to 5 years to get to market from concept. An implantable device will cost you about $150 million and about 15 years, 10 to 15 years to get to market at least. Industry nowadays does not have too much time to train people how, at least on the basics, how to do their job. They're supposed to hit the ground running, and we train our students to do that.
I came to Pitt after retiring from industry to actually set up a program. I used my own experience, but also input from other industry friends and colleagues as to what they really wanted to see in new hires.
So we are looking for someone who has a multidisciplinary experience, someone who has a complete product experience in medical domain. And what we really like about some university like Pitt, where there is this focus on the broad product.
The whole program is around start to finish, from prototyping is what we do down here in the makerspace, to FDA approval, guidelines, getting it FDA approved, and then actually in the next semester we're going to talk about taking it to market and selling the product or getting funding for the product.
All of this is much more than just technical, needs to be sort of understood. And without any of these, you're not going to have a successful product or a biomedical innovation. And having that connection to the medical, clinical world is the key. And that is what we excel at University of Pittsburgh.
They can build prototypes in our labs here, in our makerspaces, and they can just walk across the street and test them on patients and caregivers very quickly.
I love everything about the program, but specifically working with our clinical mentors, I think getting in the OR and observing them, just seeing how they interact with patients and really hearing what they have to say, what their struggles are.
And until you go in and watch somebody actually using the product, you don't realize whether it's been properly designed to suit their needs. When someone is doing a workaround with post-it notes or deviating from the protocol to make things work in their practice, that tells you there's a problem.
We're developing an endotracheal tube. So this is the breathing tube used for patients that are put on ventilators. So this actually started way back as a project in the MS-MPE program. And we since went through a process of developing it and eventually licensing the IP from the university so we could operate as a standalone company. So I think if you're someone who's really interested in having a holistic understanding of medical product commercialization, this is the right program for you.
I've always enjoyed helping people and volunteering in the medical field any way I can, but engineering allowed me to build something creatively while maybe not physically being in the OR or the clinic itself.
There are unmet problems we're facing every day. Any clinical situation you can walk into and generate ideas for new products, for new ways of doing things.
There is a tremendously growing market in this particular area. This program began officially in 2012. In first 5 to 6 years we collected data. What was the feedback from industry? And that clearly showed that our students were in high demand.